Hi everyone, Dr. Sam Gaston here with North Texas Sport and Spine, continuing our March video series on common basketball injuries. First video, we talked about ankle sprains, predominantly the lateral ankle sprain. Second video, we talked about jumper's knee. And today we're going to talk about muscle strains, which is a very common injury that occurs in basketball players, predominantly to the trunk and lower extremities. So trunk-wise, we can get those oblique strains, low back strains, pretty common when you're up under the basket going up for a rebound, coming down, a lot of rotation, a lot of violent twisting in there. Oblique strain can come from that. Sometimes you can get hyperextended or flex down too far, and that can lead to the low back strain. And then also hamstring and calf strains are very common in high-level basketball. It's a very explosive activity, so all of the jumping, everything like that. A lot of posterior chain with the leg, so there's going to be lots of high force on muscle and tendon, so strains are going to be pretty common. You see a lot of repetitive injuries to lower leg muscles, again, like calf and hamstring, and that becomes a big problem when they're not fully allowed to heal, because you see a lot with repetitive calf strains that eventually that can lead to a rupture in the Achilles tendon, which is a much more significant injury. It's going to require surgery that's going to put you out for sometimes up to a full year. So definitely want to be careful when we're treating these calf and hamstring strains, that we're giving it the full attention and respect that it deserves, because if you do rush those back, then we can go from grade 1 to 2, 3, where you're going to need surgery eventually. So treatment wise, you want to slow down on the explosive activities in the beginning, ice if it's particularly painful, and then a lot of the therapies to make things feel better, like heat, muscle stim. You can do some dry needling to stimulate healing to that area, stretching, and then as the pain level goes down, strengthening is going to be very important for the return to play there. So again, in the beginning, we want to slow down a little bit. We never want to fully stop. We don't want to immobilize it, because we need that muscle tissue to heal in the ways that it's going to be used. And then once we started working on repairing that area, slowly adding in stretching, strengthening, and then return to play. So that's a little bit about treatment of muscle strains, very common in basketball. Tune in next week as we focus on our final injury for basketball players.